Hello, everyone. It's Wednesday, April the 13th. We've had, some meetings just go a little longer than we expected, and that's why we're a little late getting started. But we've got 22 additional deaths in West Virginia. Again, it's a crying shame, but at the same time, the numbers are absolutely getting better. And please keep these folks in your prayers. And I said it over and over, but if you happen to know them, pick up the phone and call them. I mean, just pick up the phone and call them, or extend some helping hand. Please do that. The 6,756th death is a 62-year-old female from Berkeley County. The 6,757th death is a 58-year-old male from Mercer County. The 6,758th death is an 88-year-old male from Berkeley County. The 6,759th death is an 83-year-old female from Greenbrier County. The 6,760th death is a 91-year-old female from Mingo County. The 6,761st death is a 83-year-old female from Putnam County. The 6,762nd death is an 81-year-old female from Wetzel County. The 6,763rd death is a 54-year-old female from Lincoln County. The 6,764th death is a 56-year-old female from Mingo County. The 6,765th death is a 73-year-old male from McDowell County. The 6,766th death is an 84-year-old male from Mingo County. The 6,767th death is a 67-year-old female from Randolph County. The 6,768th death is a 54-year-old male from Raleigh County. The 6,769th death is a 56-year-old male from Kanawha County. The 6,770th death is a 59-year-old female from Greenbrier County. The 6,771st death is a 78-year-old female from Raleigh County. The 6,772nd death is a 71-year-old female from Marshall County. The 6,773rd death is an 87-year-old male from Lincoln County. The 6,774th death is a 64-year-old male from Nicholas County. The 6,775th death is a 72-year-old male from Preston County. The 6,776th death is a 61-year-old male from Wood County. The 6,777th death is a 72-year-old female from Berkeley County. Of these 22, there was 14 reconciliations that we have, and so you can see the total number of deaths that we have in West Virginia is surely declining, but it's still terrible. It's really sad. Really, really, really sad. We have a real way to stop this. We're really right on top of the wave right now, but if we can just remind ourselves about those booster shots, and if you haven't been vaccinated and you could really revisit this, these variants are going to keep coming. They're going to keep coming. And really and truly, you don't need to be one of these folks here. Get yourself vaccinated. It's so safe and it's so good. Absolutely try to really think about what the experts are telling us every day and get yourself vaccinated. And whatever you do, get those booster shots. From the standpoint of active cases in West Virginia, we have 326, which is great. We have 25 new positive cases in the last 24 hours. It's amazing. Gracious goodness alive, 25. 25 is 25 too many, but it is just a fraction of what we were having before. Daily positivity rates at 1.71. Cumulative rate is at 8.16. Recovered cases are still north of 491,000. We have 100 people that are hospitalized in West Virginia, 30 in the ICU units and 12 on ventilators, and we have one yellow county and all the rest of the state's green. Our unemployment rate in West Virginia is, again, a new record, an absolute record, 6 consecutive all-time in the history of West Virginia. It is unflat believable. 3.7%, breaking record after record after record. West Virginia, you're doing it. And we're so proud. I mean, you could never possibly make anybody more proud than myself, but we've been around in West Virginia for 158 years. 158 years, and now we are setting all-time records in low unemployment in West Virginia. 6 in a row, 6 all-time records in a row. You know, at this point in time, really and truly, you know, what we need to do is all those naysayers, all those doubters, and you know who I'm talking about, for crying out loud, they're out there all over the place. What you need to do is rub their nose in it. Absolutely, without any question. You know, this state's on the move and in a great way. We are doing stuff that is just flat unbelievable. You know, I say it over and over and over, if there has been a better, there is not. There's never been a better time in the history of this state to get a job than right now. It's really just phenomenal. We are growing population. You know, when population was leaving, it's not growing as fast as what we want, but it's growing, you know, and so lots and lots of good stuff. I go back to the Jobs Jumpstart program. Of all things, you know, a program that we copied from Oklahoma and thought, well, okay, who needs another incentive? Who needs another incentive that we could get more people back into the workplace? We need people back into the workplace from the standpoint of all of our small businesses. 12,000 plus more have gone and gotten a job that have enrolled in this Jobs Jumpstart program. You know, it is a fraction what we've given these folks and everything, but we've got them back in the workforce. And hopefully, we hope and pray that all of them are just as proud of themselves as the 2 ladies at that drive-through window that I went through. You could see it all over them. They were so proud to be back to work. So proud that now they have a real pride amongst, you know, within themselves and everything about what they're accomplishing and what they're doing for their families. It's good stuff. Really, really great stuff. I've already said, I remind you about your booster shots. You know, you're being very foolish if you don't take advantage and get those booster shots. From the standpoint of our numbers are still better. They're better. You know, we now have 71.9% of the 18 and over that have received at least 1 shot, and we absolutely are continuing to slow but sure get better. You know, from the standpoint of all the information on our COVID-19 vaccine info line, it's up on our website. You know, take advantage of our free testing. We have 27 outbreaks in our long-term care facilities, none in our church communities, 3 inmate cases and 1 staff case. Amazing, great work. From the standpoint of our rental assistance program and the landlords that can participate with the permission of the renter and everything, it's out there. It's out there. There's real dollars that can still be gotten, and all we need is you to apply and see if we can get you qualified. From the new homeowner assistance program, it's out there. It's now actively working and everything. Don't be foolish. Don't be foolish. If you're hurting and you can absolutely just call and double check and see if you can qualify, it helps us all. Not only does it help you first and foremost, but it helps all West Virginia, because that multiplier effect of those dollars that you're going to receive will absolutely go a long ways to help a lot of people in West Virginia. Give blood. Don't forget this. Give blood. You know, look, you know, be sure that you take advantage of the new vaccine calculator that will tell you when to get your booster shots, and it's just another tool in the chest that we can use to our advantage. CDC, like I said earlier, has approved the 2nd booster for people 50 and older. Come on, West Virginia. We don't need you on this list that I read, you know, every day that I come. You know, we don't need you on that list. We need you protected. And in this 2nd booster, you need to take advantage. Don't wait. Don't wait around. It's so important that you get this 2nd booster shot now. I've told you about our Jobs Jumpstart program. We've launched it in January. We've got 14,685 West Virginians that have applied, and 12,533 have been approved. Now, that's 12,533 people that are moving into the workforce right now. It's good stuff, great stuff. Okay, I got another big announcement for you, so buckle up, here it comes. You know, in Mason County, Frontieris North America today announced it will construct a plant in Mason County. The plant, which plans to be able to complete construction, will be operational in the fourth quarter of 2023. It's expected to employ 500 employees and the process to use more than 2.7 million tons of our coal at this plant. Absolutely, we want to be an energy powerhouse. We thank Frontieris North America. You know, we can't just come out with these announcements because we're under confidentiality until we get across the finish line. We're there. Absolutely great stuff. Another 500 jobs pouring right into West Virginia and into Mason County. And who knows how many multiplier effect jobs. 2.7 million tons of annual coal production that will go to this plant. You know, it's testimony to all the great work that we've done through our legislature and all of us in making West Virginia more business friendly. We want people to come to West Virginia. We want them to know that we're the diamond in the rough that they missed and everything and all that great stuff. We want them to know that West Virginia can be the energy hub. West Virginia can be the spark that makes this nation, again, energy independent. Absolutely, which we should be in every way. We see the god-awful stuff that's going on in Ukraine and all the worry that's going on all across Europe and everything. And here we sit on our hands, you know, canceling pipelines and everything else under the sun. You know, without any question, the Biden administration went way astray, chasing after really way out ideas of the left. You know, I don't know that they can reel themselves back in, but the very best thing that they could do is absolutely reel themselves back in right now, or they're going to end up with the god-awfulest whitewashing in the world in the midterms, which it will delight me. But I do not want us to suffer anymore in this country just so they'll lose in the midterms. I want this nation to be super strong and West Virginia to lead the way. West Virginia is doing it in so many different ways. We know we've got the hardest working people. We know we've got the craftsmen in West Virginia. It's really good stuff. And I told you that I'd take you on a rocket ship ride, and now you're riding, and you best better buckle up even tighter because it's going to only get better and better and better. Last thing I've got is just this is, I've got two things. You know, the RFQ on my initiative with trying to make DHHR better, you know, is out. It should be coming. It's really close to coming to me for my approval. Once it goes out into the marketplace, then we'll solicit the very best minds in an unbiased way, and we'll make DHHR better. DHHR, just like our roads in West Virginia, it just didn't get this way on my watch. It's been this way for decades and decades and decades, and we want to make it better. And so we're reaching out to the experts, and we're going to make it better. So last thing I've got, how could there be any holiday that could approach anything that is as dear to our hearts and as meaningful as Easter? This Sunday, I want you to celebrate Easter. I want you to think about all of your blessings and all of the obligations and who we owe all of everything to. We owe everything we have to our Lord, to God above, in every way. It's a holiday that we should be celebrating every day, every single day. We should be so thankful, you know, and so nevertheless, that's all I've got, and you know, I wish all West Virginians a really happy Easter, and I really would hope and pray that you'd stop and at least stop and pause and offer up your thanks. So that's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and following up with what the governor said, I only have a few comments today. The first one is that data just came out recently that delineated 2021, showed us that the year 2021 was the highest mortality year in the history of the United States. And that was having about 3.5 million deaths from all causes in the United States and about 500,000 excess deaths, which were felt to be related to COVID. And because of that, in 2020 and in 2021, that we've seen such large mortalities, such large numbers of Americans dying, that there has been also a reduction in our life expectancy. And versus other westernized countries that are rich like we are, then we have lost about 5 years of life expectancy. And it's the first time really since the world wars that we've seen that kind of drop. And in the United States, we've lost 2.5 years of life expectancy in the last 2 years. And that's because of excess deaths, not only from COVID, but we also know that we had 100,000 deaths from overdose from drugs in 2021 as well. And so as we look around the world and we see that the countries that are not prepared, that don't have the appropriate amount of immunity, are now starting to suffer the consequences of COVID-19, including countries like China, like Hong Kong, where there was a lot of mitigation measures, a lot of isolation and tracking, but perhaps not as much as a solid foundation of vaccination. And certainly the fact that their population didn't see the virus as much at the earlier parts of the pandemic and to gain some sense of natural immunity also is likely affecting them. So as we look at our own country, as the governor has said, for each press brief, it is really so important in our state that we vaccinate and keep up to date the shots that people should be getting. And please, if you have a question, go to the vaccine, the vaccine calculator on vaccinate.wv.gov and then see if you are eligible. And if you are, it is really important to keep up to date on that, because what happened in the United Kingdom is they were farther away from their last vaccine series, and the Omicron variant didn't, in fact, and allow natural recovery from Omicron, is at least the feeling, which is the reason why they've recently spiked with more hospitalizations, more deaths. And it looks like the US at this point is starting to see more cases, particularly in the northeast part of the country, from BA.2 variant of Omicron, but we're not seeing the number of hospitalizations or death yet, which is heartening because of the benefit of the vaccinations and now new boost available for our older populations, the second booster shot, and also because people have recently gotten infected and have recovered during this large surge that we saw during the winter to the spring transition. So West Virginia, it's really important to get vaccinated. We know that the BA.2 variant continues to grow and is now the dominant variant in the United States. Still about 20% of the cases in West Virginia, but we know that that will change as well. And we want to be ready and we want to save lives. Thank you very much.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. I just wanted to follow up on the question that was brought up regarding nursing home long-term care facilities. So we are, as pointed out on Monday, we're continuing to use the same tactics and procedures we used with the Healthcare Association. Their current estimate on third shot, which would be the first booster, is that over 85% of the residents of facilities that they support have received that dose. And we have created an on-demand system working with local pharmacies, the facilities that do maintain their own vaccines, and other entities such as rural community health clinics. to make sure that we have that on-demand system in place. Based on the way CDC manages the flow of information in on fourth doses, the Healthcare Association will have to go back and do an individual count like we've done in the past with each of those facilities. And we'll provide you updated information on that as it goes forward. But individuals across the state and families need to be assured that we have the on-demand system in place. We also have available for any individual going into a facility a first shot, a second shot, third shot, and fourth shot availability for those going forward. So a lot of work continues to be done there. Related to data overall, our data analytics team is working on some updated ways that we can better track at the state level how these fourth doses, fourth shots are administered, as the system that's set up right now nationally does not delineate between third shot and fourth shot in the booster calculations. And then the last area is we continue to upgrade and update opportunities for surveillance testing going forward and better ways to provide that, particularly now that we have so many home tests being done. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. Unfortunately, the Bureau for Public Health has confirmed an influenza-associated death with a pediatric patient this year for the 2021 through 22 season. The last time we had a pediatric death was 2019 through 20 season. So flu deaths are rare in pediatric patients, and we are required to report those to our health departments. Adult flu deaths are not, so we don't normally have those numbers readily available. But to protect the family's privacy, we won't provide any more information about the child. This is just a reminder that flu vaccines are still available, and we do recommend that you still go out and get one if you're 6 months, years, or older. Thanks, Jordan.
Thank you, Doctor. Secretary Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Randy Yohe at West Virginia Public Broadcasting.
Good afternoon, everyone. Governor, I'd like to stick with talking about employment if we could, because I'm trying to understand these labor force participation numbers. I see where West Virginia is at 55% and the national numbers are 62%. That calculates to 7% of the state population that could be working. If we got to that U.S. average, that would be about 100,000 more workers. So I kind of want to know what else besides your Jobs Kickstart program is being done or can be done to increase this labor force participation.
Randy, to be perfectly honest, you know, I mean, I can give you an answer, you know, but my answer would be more at 100,000 feet than the technical answer that you really deserve. And I'm going to have our workforce people come on, and they'll come on, you know, the first briefing that we have next week. And, you know, but I do believe that, you know, our workforce, our folks are working with, you know, the vocational schools and employers and everyone to get more folks out to work and everything. Historically, you know, we're up and going surely in the right direction, but that's more 100,000 feet. Let me bring them in and get you more detail and everything, and I'll do that first of the week.
All right, thanks, Randy. Next, we'll go to John Mark Shaver with West Virginia News.
Good afternoon, everybody. I have a quick question on the second booster shot. I'm looking to know what's the demand you guys are seeing from that for the second booster right now, and how would you compare it to the previous shots and booster rollouts? Thank you.
Maybe Dr. Amjad or Dr. Marsh, please, y'all go.
Yes, Governor, I'll start, John. It's hard to give a quantitative number to that, actually, based on what General Foyer just gave the information, because right now, if people were to go and get a shot, you know, it's hard to calculate if it's the third shot or the first booster or the second, fourth one that you're asking about. So right now, we're still trying to get a handle on that. So I don't want to comment if, we're seeing more or less really, because I don't have a quantity to give you. I don't know if Clay has anything to add to that.
No, I think, Ein, you're correct. The only thing I might add is just that nationally we are seeing an increase in demand for the second booster for the age groups that are involved and have been delineated by the FDA and the CDC, which is people over 50 years old who are 4 months from their last shot, their first booster shot, or people that are immunocompromised at 12 years or older who are 4 months after their last shot. So ultimately, that's the reason why the vaccine calculator is so effective to use for people. But in West Virginia, as General Hoyer has very nicely said, and Dr. Amjad as well, the tracking of that dose has been challenging. And so hopefully we will have more information for people soon.
All right, thank you. Governor, I'll turn it back to you.
Oh, well, okay, well, we're back fast here. Okay. Randy, your question on workforce participation and our low unemployment rate and everything, I think it's a great question. We need more detail. I would tell you, to the very best of my knowledge and everything, the way it's calculated, we've been calculated the same forever. And so from the standpoint of, is it all-time low records? Never, without any question. There's no question in my mind whatsoever. But to dive in and get your answer more precise and everything, we'll do that next week. I make notes all the way across and everything as we, Dr. Marsh said, it came out today, I think, that in 2021, the highest mortality in the United States that we've ever had, maybe in a single year. I think he said 3.5 million people died in the United States in 2021. And he gave us a whole lot of other great statistics and everything, but surely not all those people died and everything in regard to COVID, but COVID took a real big toll. That's all there is to it. Probably well in excess of 500,000 people of the 3.5 million. I celebrate over and over all this news about these people coming. I mean, the great people that come to our state and everything, Frontiers to North America and on their way. This is major, major, major jobs. I mean, 500 jobs, but not only that, all the product that goes into the plant, the 2.7 million tons of coal, that's going to be mined in West Virginia, absolutely could not be better. And they're going to be up and running by the fourth quarter of 2023. That's really that's probably 18 months from today or less. It's a really a real quick timeline. And so there's, this process, I'm gonna read this to you, this process, this process results in the delivery of fast form liquid and gas offerings, as well as a cleaner version of coal known as fast carbon that will be leveraged by the steel companies, by the steel industry. So all good stuff, all great stuff. And but at the end of the whole thing, I just tell you just this is, please take time to do what I said about Easter. Easter is such a sacred holiday, and I wish you all a real happy Easter. Baby Dog wishes you the same, and so enjoy your family. And I know we've been through a couple of really tough years, but West Virginia, you've held together, you've pulled the rope with me, and we're going to run across the finish line together. So God bless each and every one of you. Please keep in prayer 6,777 West Virginians we've lost, but we're going to get through this, West Virginia. Very proud of you, and very humbled, to be your governor. Thank you so much.